This is Indiana Regional Medical Center. With facilities in Indiana, Chestnut Ridge, Marion Center, Northern Cambria, and Seward, we provide the community with quality, progressive, and compassionate patient care. As we celebrate 100 years of service, let's look back and see where we began. Medical services in Indiana County began with Dr. Jonathan French, who served the county from 1807 to 1814. Today, Dr. French is buried in Memorial Park. During the late 1800s and early 1900s, various small hospitals sought to meet the needs of the community. In the early 1900s, coal mining and the railroads helped fuel a new round of economic expansion in the Indiana area. The New Century Committee, formed in 1902 to help plan the county's centennial celebration, would become a leading force in the effort for a modern hospital to serve the region. In 1903, the Indiana County Hospital Association was created. A.S. Cunningham, a local businessman who owned the mercantile store in the 600 block of Philadelphia Street, offered 3 acres of land for the hospital. The Buffalo, Rochester, and Pittsburgh Railroad, along with local coal companies and railroads, announced their support. With the endorsement of the New Century Club, the Hospital Association was revised in 1907 and intensified its efforts. The revised association was one of the first organizations to provide women an equal voice on its board, with 15 men and 15 women. In 1907, the association prepared and submitted an application for state funding. Unfortunately, the request was denied and the effort stalled. In 1912, the effort restarted with a new intensity. An unnamed businessman pledged significant funding if the community would raise $10,000 towards the project, which was to cost $60,000 or more. John Elkin, John Fisher, Henry Hall, A.S. Cunningham, and C.M. Lingley comprised the subcommittee that helped spur the new effort. The project received a major boost when Adrian Island of the Rochester and Pittsburgh Coal Company, the unnamed businessman, came forward and pledged $40,000 towards the hospital building. A 54-acre tract of land, the site of the present hospital, was acquired from the George C. Dickey estate, a local businessman who died of pneumonia at age 62 in February 1912. On October 29, 1914, the Indiana community sees its new hospital dedicated. The 3-story structure, a gift from Adrian Island and his sister Georgine Island, cost $141,000 plus an extra $16,000 for equipment. With the new facility ready, attention turned to the staffing and equipping of the facility. This included hiring a superintendent, Miss Sarah M. Morgert Leventry, and a directress of nursing, Miss Eliza B. Dill Wyman. In 1915, through the donations of the Island family, the hospital acquired a motor ambulance and x-ray machine. On New Year's Day, 1915, the first class of 14 students began their studies at the hospital's nursing school and would graduate in January 1918. On February 11, 1916, the new hospital faced its first critical test as an explosion at the Ernest Mines killed 27 miners. The hospital's response helped demonstrate its importance to the community. During the First World War, the hospital played a significant role in treating soldiers returning from Europe. Many soldiers were served at the hospital. Both Sarah Morgert and Eliza Dill, along with 6 other nurses, would serve with the Red Cross or the U.S. Army, most at the Walter Reed Medical Center, working with wounded soldiers. As the war ended, returning soldiers brought home a deadly souvenir, the Spanish influenza. An estimated 500 million people worldwide were infected, with some 50 million deaths. In the first month, Pennsylvania saw 24,000 deaths. The state had the highest mortality rate from the pandemic in the nation. Indiana did not escape. By October of 1918, Indiana recorded over 100 deaths from this disease. To handle the pressures of the epidemic, the porches at the hospital were enclosed to provide additional space. In the 1920s, the hospital continued to grow, increasing the size of the nursing school, becoming a member of the American Hospital Association in 1926, and opening its first operative clinic in 1927. In October 1926, a diagnostic clinic focusing on childhood polio was held with the support of the Indiana Rotary, and in its first year would treat 236 children. As the 1920s were drawing to a close, Indiana's hospital was established as the central healthcare provider for the region, but its growth was just beginning.